So today I'm going to demonstrate the nasogastric tube feeding. So the purpose of this is to provide an adequate nutrition through feeding, and those patients who are unable to feed themselves, and for those patients who undergone with the surgery of oral, unconscious, and comatose patient, and also this have a purpose to administer some medication. So for the necessary materials that we need to use is the prescribed tube feeding formula, the room temperature feeding bag, stethoscope, a enteral pump feeding if ordered, a water for irrigation, a other measuring device, a additional PPE as indicated, a clamp, a IV pole, a rubber band, a disposable gloves or non-sterile gloves, a disposable pad, a tissue, and pH paper. So now for the assessment, so we need to assess for the abdomen if for the presence of distension, and auscultate for the bowel sounds, and peristalsis, and palpate for firmness and tenderness. So after that, we're going to assess for the patient's and family understanding if the appropriate for the rationale for the tube feeding, and address for some concern and some question for that expressed by the patients or family. So now, as we move on to the procedure, so we're going to check for the amount, type, concentration, and expiration date of the formula of the tube feeding in the patient's chart. Okay. So now, we're going to assemble for the equipments that we need to use, and then we're going to perform hand hygiene, wear a PPE, wear a gloves, face mask, in order to prevent the spreading of microorganisms during the feeding. So now we're going to identify and verify for the client to receive the feeding. So good day, sir. I'm Audimay D. Espiritu, student nurse from Wesleyan University, Philippines. So I'm here po in order to, may I know your name and birthday before anything else? Okay. So sir, I'm here po to give you a feeding through your tube in order to have an adequate nutrition. So do you have any question po regarding with that procedure? Okay. So now sir, can you elevate po? Po. So now as we place the client in a high Fowler's position, or elevate the head for about 45 degrees in order to maintain the upright position. So this is to prevent the bronchial intubation aspiration as the client's vomits during the feeding. So now we're going to, as we gather all the materials, so we're going now to close the curtains and to provide the privacy for the client, raise the bed in order to have a comfortable working position as we place the client on the high Fowler's position, and then we're going now to drape the client using the disposable pad. So now we're going to assess the client. So sir, I'm going to put the stethoscope on your abdomen. Okay. So now we're going to palpate. So now we're going to check for the tube if it is intact. Okay. So now we're going to attach a syringe to get a small amount of stomach content and test into the pH paper. So sir, magkano lang po ang ano? Okay. So we're going to place in this container. Then we're going to get a pH paper and we're going to compare it after 30 seconds to colored with chart supplied by the manufacturer. So as we see here, so the result is it is straw with clear or straw colored that appears like a deep golden yellow, which is an intestinal aspirate. So now we're going to aspirate the gastric juices on the stomach to see the residual amount, because so we're going to kink first. Okay. So now we're going to flash a water with 30 ml. I'm going to use this. And I'm going to kink. So using this, so we're going to use a stethoscope to hear a borborygmi sounds. If the tube is still intact to the stomach. Okay. So now for the feeding, using so as we heard the borborygmi sound, which is the normal sound for to check if the tube is still intact on the stomach. So now with the use of feeding through syringe or large syringe, it is an open system. So we use another syringe, which is a sterile syringe. So now we're going to remove the plunger. So first we're going to kink to avoid air, and then we're going to remove the plunger, and then place to the MS basin, and then we're going to kink again. We're also to kink to maintain kink the tube. Then using the milk, we're going to stir, and then we're going now to feed every 30 ml. Okay, release the kink. As we can see, if the feeding is going to empty, so pour a milk. Okay. So as we can see, we can flush a water right after the milk. Then as the water pours down and empty, then kink again. And then we're going now to remove. So if you see spilled water, so use a tissue. Then we're going now to close it. So now, after feeding the patient, so we're going to observe the client with during and after the feeding, and then after that, we're going to instruct the patient or the patient's guardian to remain in that upright position within after 1 hour of feeding to prevent any risk of aspiration. So, sir, we're done na po with our feeding. So, please remain with that position po. After 1 hour po, after 8 a.m. po, you can now lay down na po. So, now we're going to remove all the equipment we used and discard it to the proper waste receptacles. And then after that, we're now going to discard all the necessary materials and do hand rub. And document all and record all the procedure done. So that would be all for the nasal